My name is Joan McLeod and I'm a pharmacist employed by NHS Grampian. I'm a rarity in that there's not many of us working in primary care. For anybody with COPD, the pharmacist that you'll come into contact the most is your community pharmacist. Most often this will be when you collect your prescriptions from the pharmacy. It may also be if you go in and want to buy some over-the-counter remedies from them. Most people fall into the trap of thinking that the community pharmacist is there just to supply their medicines. However, they're actually there to help and support anybody with any medication related issue. So for patients with COPD, the community pharmacist is somebody that you can go into, ask about your medicines, what they're for, how you should take them, if there are any side effects. Just ask is the key thing with them. There are many medicines that can help patients with COPD. I think we have to be honest and say that none of the medicines that we have can undo the damage that has been done in the lungs. However, they can help relieve many of the symptoms that you experience. They just won't make you 21 again. Broadly speaking, there are two ways in which medicines will help you if you have COPD. They will either help by opening your airways out. When medicines open your airways out, this allows the air to flow in and out of the lungs a little bit more easily, so will relieve the symptoms of breathlessness that you often experience. Again, they might not take the breathlessness away fully, but they will help. If the medicine isn't doing that, what it will be doing is strengthening your lungs. If you have COPD, you're often more prone to get chest infections, flare-ups. So what these medicines do is they calm that down and they will reduce the number of chest infections that you're likely to get. Again, they won't stop you from getting chest infections, but they will help. Some of the medicines we have actually do a bit of both. With COPD, because it's a condition of the lungs, the safest and most effective way to give you those medicines is actually through inhalers. So there are a few medicines which you might get as a capsule or a tablet and have to take orally, but the vast majority will be given to you in inhaled devices. This means that the drug gets directly to your lungs. It'll therefore act a lot faster. There's fewer side effects, and there's also much fewer interactions with other medicines when we deliver the drug directly to the lungs. However, different companies make different device types, so you may find that you can be prescribed 3 different inhalers and they all look slightly different. They may be different colours, different designs. The most common one would be the metered dose inhaler, which is a puffer style of inhaler. Most people are familiar with that one. That one can be used with or without a spacer device. If you aren't prescribed an MDI and spacer, then you will be prescribed a breath actuated inhaler. These ones are easier to use than the MDI. The most common ones that you will be prescribed are the Easy Breathe, the AccuHaler, the Turbohaler, the Handyhaler and the Genuair. What I would say is really key is that when you are prescribed inhalers, that there's 2 things to do. One is find out what the drug is, what it does, how often you need to take it, and when in the day you would be taking that. You can also find out if there are any side effects. What's really important is that you do check that you're using your inhaler correctly. It's actually very easy to use inhalers incorrectly and still think that you're taking the drug. If the drug doesn't get to your lungs, it's not having a benefit for you, so you're not actually getting the best out of your medicines.